This lecture will cover Chapter 63, Antifungal Susceptibility Testing, Therapy, and Prevention. Antifungal susceptibility testing aids in selecting the appropriate antifungal agent to treat a particular infection. And these standards are set forth by the Clinical Laboratory Standards Institute. So they publish guidelines that specify how you performed the susceptibility testing. So those documents, each of those documents is very specific for the particular type of fungus that it sets the standards for the type of testing that you do. Antifungal susceptibility testing can be very costly as well as time consuming. We've learned that several of these fungi tend to take time to grow, so it could take some time to actually get the results on that susceptibility testing. It can be of value in certain situations, and one of those would be to determine an antibiogram for isolates within a particular institute or hospital. So what an antibiogram does is the institute will study organisms in their area to see which antibiotics work best for those particular organisms, and it also helps the infectious control committee to kind of determine what antibiotics to keep on site to treat with before they can go ahead and start treatment before the susceptibility results come back. And sometimes organisms in one area may act a little different than organisms from another part of the country, so it's good to know what you see in your area, or if you're starting to see organisms that are developing some sort of resistance. Some of the problems that can come with that kind of make it complicated for interpreting the results will depend on the condition of the patient, the type of infection, and the drug's ability to penetrate that particular area of wherever that infection is, the dose of the drug that's given, the makeup of the drug, and it also can be dependent on the method that was used for the susceptibility testing as to how accurate it is. Some species can demonstrate resistance due to being previously treated with antifungal agents, and so with that treatment then they can kind of mutate a little bit over time, so it can make them resistant and difficult to treat later. So just to explain to you a little bit how susceptibility testing is done. With all of these here that you see, these are all agar media where the organism has been placed onto the agar, and then the particular antifungal is added to it, or it may be infused in it. So for example, here up top you have a Candida albicans that was cultured into all of these little wells here, are agar wells. So there's a little bit of agar in there, and this agar will have different titrations of antibiotic in it. So you can see where there's like a 0.5. This one has 0, and I can't tell here at the bottom. This may be 1, and this I think was 2. And so the organism itself is cultured onto each of these little wells of the agar, and so you can see where there's no antibiotic that you've got a little colony that grew, and then with 0.5 there's no growth all the way up through 2, and so this one is susceptible. Over here with this one, it was cultured, and you can see little tiny growth. All of those little specks of white there are colonies that have grown, and so you can see that it grew in the 0.5, the 1, and the 2. So with that, what you've got going on is a resistance. So it was resistant to the antibiotic, there was no growth. So you can see with each of these there's there's dilutions of that antibiotic. So you can see some different growth patterns there. With these other cultures, these plate cultures, you actually, when you streak the plates, you take an inoculum of that colony, usually in some sort of broth dilution or saline dilution, and then you cover the whole plate, usually with something like a swab, works best. So you've kind of blanketed the whole plate with that colony or that organism. The whole entire plate is covered. And then you place these little discs, which are saturated with an antibiotic, or in this case, antifungal. And what you're looking for after giving some time for that culture to grow, you're looking to see if it inhibited the growth. So you can see this little circle here where it did not grow in this area. It grew all out here, but not in this circle. So this antibiotic sort of leaches into the agar and it inhibits the growth. And so you would actually measure how far out the growth is inhibited. And when you compare that to those standards, you would be able to tell if that growth pattern or that inhibition of growth pattern is considered susceptible or resistant. So if it's susceptible, it does not grow, and if it's resistant, then you have growth all the way up to that little disc. So you can see some patterns over here where this had like a little bit of no growth, not much, but for the most part it grew up to it. So all of these would be resistant. And then you can see here, just depending on what the measurement is, these may be susceptible. So up here at the top where you have this little wagon wheel looking thing, it looks like these are probably either different antifungals or different strengths of it. I'm not really sure. And you can see where you have growth up to a certain point with some of these. This is a pretty big growth with this one, so I'm pretty sure this is probably a good choice to use. This one kind of grows all the way up to it. So that would be considered resistant for this one, and maybe this one. It's hard to tell because of the angle. And here you can see it a little bit better where you have the colonies, all these little tiny specks of colonies that grow up into about this point here. And so right around that disc you have no growth. With this here, this little strip, it has the antibiotic in it, and you look for growth up to a particular point, and wherever that is, you would read it. So it's a number value, and you would compare it to your standard to determine if it was susceptible or resistant. And so you can see that over here in this top corner as well, where you have no growth up to a certain point, whereas there's a lot of growth here, so this would be resistant on this one. And then you have broth dilutions. So these long strips are E-test, and then broth dilutions would be in some of these micro wells. So you can see you have no growth, and then you start getting a little bit of cloudiness where you have some growth. So you can see some of these where you have growth. So depending on where there was no growth would determine if these were susceptible or resistant. And this top one, I'm not exactly sure why there's some color variations, if it's something in there that causes, if there's growth, if it causes a color change or not. So I'm not very familiar with this particular type of plates. But here you can see in this chart where you've got the drug or the antifungal, and so you have all of the different types, and then you had the E-test, which is that strip, and you've got your ranges, and so these are all your ranges, and then you're looking for what your result actually was. So this one you had a less than 0.12. So with your range over here, As long as it's in that range, it is susceptible. And then this one was greater than 64, so you would want it anything greater than 32 would be resistant. So that's how you would interpret those. So with your antifungal therapy, what these antifungals target is the cell membrane or DNA synthesis or protein synthesis or glucan synthesis. So depending on the particular antifungal depends on how it affects the particular organism itself. First we have the polyionine and macrolides. We have amphotericin B, which is produced by streptomycin. We have the nystatin, which is produced by streptomycin. And we have the griseofulvulin, which is produced by Penicillium species. And we also have the 5-fluocystine, which actually is metabolized to the product that is used. Amphotericin B is used to treat invasive Aspergillus, Candida, Cryptococcus, and the Mucorales. And so it acts on the cell membrane wall of the fungi. And there are several organisms that are resistant to this particular antifungal. Nystatin is not absorbed in the GI tract, so it's just to treat oral or vaginal candidias. Griseofulvin will bind to the microtubule protein, so it acts on the protein synthesis, which is used for mitosis. And so this one is used as an oral, or you can ingest it to treat the dermatophytosis infections which do not respond to the azole antifungals. And the flucystine is incorporated into the fungal RNA, which inhibits the protein and DNA synthesis. So this is usually used along with the amphotericin B and is used to treat the Candida species and the Cryptococcus. The azoles will disrupt the integrity of the fungal cell wall. These include the imidazoles and the triazoles. Clotrimazole and meconazole are used a lot with vaginal yeast infections, so these can be bought over the counter. And they can also be used for mild cases of dermatophytosis and tinea viscosa. The ketoconazole can be taken orally or it can be applied topically. And this can be used to treat mild cases of paracoccidiomycosis. It can be an alternative to the amphotericin B for the blastomycosis or histoplasmosis. And it's used if prolonged oral therapy for chronic mucocutaneous candidias is needed. Fluconazole is good to administer oral or intravenous because it is water soluble, and it is effective against some Candida species and Cryptococcus neoformans. And since it can reach therapeutic levels within the central nervous system, this is why it's good for treatment of Cryptococcus meningitis. But there is some resistance with certain Candida species, and it does not prove to be effective against Aspergillus or Fusarium. The itraconazole provides a little bit of a broader spectrum than the ketoconazole, and it is effective against Aspergillus and Sporotrichosis as well as Cryptococcus. Voriconazole works similar to the itraconazole, but this one does prove to be effective against Fusarium. It does not work for some of the fluconazole-resistant Candidias and other Candida species, and it does not work against the Mucorales. Posaconazole is an oral azole, which is similar to the voriconazole, but it is effective against the dermatophytes, some of the Candida species, Aspergillus, Cryptococcus, and the Mucorales. It is less effective against the Fusarium and the P. boydii. Echinocandin agents work by targeting the fungal cell wall, inhibiting the glucan synthesis. And so these meds are only available through as an IV med, but they are very effective against the Candida species and Aspergillus, and they can be used as a prophylactics type treatment, or as well as just treating the Candida species. So prophylactics may be a way to prevent getting a Candida species if you think your patient is going to be susceptible for some reason. It is ineffective against fungi that like the 1,3-beta-D-glucan, which includes the Cryptococcus, Trichosporins, Fusarium. With the allylamines, one that you may be familiar with would be like the brand name Lamisil, which is used as a topical cream for athlete's foot. And what this particular medication does, or topical cream, it acts on the fungal cell wall synthesis. And they're highly lipophitic, so they're able to penetrate into skin and nails or any sort of fatty tissue. With the selenium sulfide, this is put into a shampoo form, which is used to help treat with the tinea vesicola. It also can be a type of treatment for the trichophytins as well. Potassium iodide is used for the cutaneous or lymphatic sporotrichosis.